All right, welcome everyone. We are so glad you're here today. I'm really excited to have Matthew and Audrey here from the diaTribe Foundation. They will share more about some of the great programs diaTribe has to offer and ways that you can get involved. Listen, I've been a fan of diaTribe for as long as I can remember, and I hope you will be too after today's webinar if you aren't already. Let's do some very quick introductions, and then I'll do some housekeeping. Matthew, can you please introduce yourself?
Of course. Hi, everyone. I am so glad to be here. My name is Matthew, and I am the director of the dStigmatize program at diaTribe. And I've been at diaTribe now for a little over 5 years. I love all of the work that we get to do and just can't wait to share it with you all today.
Amazing. Thank you, Matthew. And Audrey, how about you?
Yes, thank you so much for allowing us to be here. My name's Audrey. I'm the Senior Manager of Digital and Outreach for the Time and Range Coalition. I've been with diaTribe for almost 3 years now, and I've been living with type 1 diabetes for 17 years, close to 18. So excited to be here and to get started.
Absolutely. Well, thank you. I'm excited to have you both as well. Real quick, my name is Scott Johnson. I'm a senior manager of community here at Blue Circle Health. I've lived with type 1 diabetes for 45 years, and I just really appreciate you sharing some time with us today and allowing me the honor and privilege of hosting. In terms of an agenda, we've got a great presentation that Matthew and Audrey will guide us through. And then we're just going to spend some time together asking questions and digging into some more details. So please feel free to ask any questions you may have in the chat or Q&A window, and I will get those to Matthew and Audrey when the timing feels right. Now, as with many of these, we may not be able to get to all the questions, but we'll do our best to do that and follow up afterwards as best as possible. Now, before we get going too far, I do need to cover some quick housekeeping items. Again, we welcome and encourage you to use the chat feature along the way. I'll keep an eye on it throughout the session if you need anything during the presentation. And then just a few more things I do have to mention. This session is being recorded. Participation in this event is completely voluntary and may reveal your identity and any identifying information that you share with other group participants. So, for example, comments in the chat or during discussions, things like that. We're not providing medical advice, individual or otherwise, and may refer you back to your healthcare team for individualized answers and care. And then finally, for anyone who's not familiar with Blue Circle Health, stick around till the end and I'll share a brief overview and then be available to answer any questions that come in. All right, I know that was a lot. Thanks for your patience with me. Let's go ahead and get on with the good stuff. Matthew and Audrey, over to you.
Awesome. Thank you so much, Scott. So, yeah, we'll start out with a little bit of a presentation. Audrey and I just wanted to be able to take a little bit of time to give like a little bit of background and context to the work that we're doing at diaTribe, because not everyone knows all of the different programs and initiatives that we are a part of. And then we'll, like Scott said, jump into some more in-depth questions about all of our programs, but with a little bit of a focus on the work that Audrey and her team do on the Time and Range Coalition. So with that being said, I will start us off just by saying that at diaTribe, we are a small nonprofit, and our goal is to help people with diabetes through education and advocacy. Our team is spread out all over the United States. We are headquartered in San Francisco, so if you happen to be in the Bay Area, always feel free to shoot us a message and say hello. And at diaTribe, we've been around for a little over 10 years. We were founded in the early 2010s by an amazing internationally recognized diabetes advocate named Kelly Close. I am sure we will talk a little bit more about her and some of the work that she's done at diaTribe later. And we have three main programs. So I'm going to cover a little bit of our diaTribe Learn program and our dStigmatize program, just as teasers and as a quick intro to that work. And then I'll pass it over to Audrey for a little bit more in-depth information about our Time and Range Coalition. So diaTribe Learn is our flagship program. It was kind of the basis for all of the work that we do at diaTribe. The Learn program's mission is to empower our readers with useful, actionable information that gives people hope and helps them live happier and healthier lives. So the whole kind of genesis for Learn came when Kelly Close realized that there was a lot of conversations happening that were kept in these silos where just the scientific or the medical community was talking to each other. And that information was never actually making its way to the diabetes community, the actual people who are living with the condition. So, what she wanted to do was start a website and a newsletter that covered a ton of different topics, things like FDA approvals, clinical trial results, tips for diabetes self management, or how to navigate complications, food, exercise, medications, you name it. We've probably talked about it at diaTribe Learn. And we approach all of these different topics with basically a goal of making it as accessible and easy to understand as possible. We want people to actually learn something and then take that information away and use it to inform their own diabetes care. Now, if you have never encountered Learn out in the wild, the easiest way to find us is to go to our website, diatribe.org. All of our articles, tons of historical archive, and our latest content can all be found there, as well as ways to navigate to some of our other programs. But if you're interested for some more kind of direct to your inbox information, we do have 2 newsletters that anyone can sign up for, and they are absolutely free. Our first is our weekly Learn newsletter, which has been around for longer than I've been at diaTribe. You can sign up at that QR code right there, and I'm sure we'll be able to share all of this information with everyone after the fact. But that weekly newsletter is going to have 5 in-depth stories delivered right to your inbox every Tuesday with interviews, nuanced takes, recipes, and all kinds of good information. Now, if you're like me and you like a little bit shorter form content, we also have our Daily Drop newsletter, which we actually launched just this year. And that newsletter will come to your inbox every single day, Monday through Friday, and gives you 3 little kind of quick bites of the latest diabetes news. So if there was a study that was just published, an FDA approval that just came out, or maybe some really awesome clinical trial results, you'll definitely see those show up in that Daily Drop newsletter. And we try to give you just kind of a quick little bite of information. What's the most important thing to know? And then if you hate reading, because hey, maybe you do, we also have a really wonderful way of still getting all that information in a different format. And that's our live webinar series. So diaTribe Musings is a virtual panel event that we run multiple times throughout the year, where we pick interesting topics, a lot of them things that we've covered in diaTribe Learn, but we go into an in-depth discussion with a panel of experts, people with lived experience, and advocates to really dive in and get a better understanding of what the latest science on a certain diabetes complication might look like, or on what medications might be newly available to people. And all of those panel events are available on our YouTube as well. Shifting gears a little bit to some of our more advocacy focused work, and the program that I get to run is dStigmatize. Now, the mission here is an understanding that addressing diabetes stigma is an essential missing element of effective diabetes care. And that's the reason why we launched dStigmatize. We want to raise awareness around this issue and inspire actual interventions to address it. We know that diabetes stigma impacts roughly 4 in 5 adults living with diabetes. This is consistently found in some of the research around diabetes stigma. And we know that stigma can impact a ton of different aspects of diabetes care. And it can negatively impact people's mental, physical, and social outcomes as well. So we see that when people are experiencing diabetes stigma, oftentimes they may also have higher A1Cs, or maybe they are less likely to inject insulin in public or to measure their glucose levels in public because of that fear of experiencing judgment or blame. Our dStigmatize program has a ton of different initiatives, and I'll cover a couple of them in a little bit more detail. But at its core, we focus on research because we really want to understand diabetes stigma, not just at a high level, but really get into the nuts and bolts of it. We focus on educational resources and events for healthcare professionals because we know that they care a lot about helping people with diabetes but also the healthcare space is ripe for those stigmatizing experiences that people report. And then lastly, so much of the stigma kind of narratives are like deeply baked into our culture and our society. Those like stereotypes that diabetes is caused by sugar and, it's all your fault. That is like directly baked into the social media that we encounter, how diabetes is represented in media, or just the comments that you constantly hear. And we want to find a way to hack the culture a little bit and maybe inject some new narratives that are more respectful and empowering and inclusive. So, two of the big initiatives that we have are our dStigmatize resource library. This is in that healthcare professional education bucket. And it's all of our resources at the library are free to download, free to use, free to share with your healthcare professionals if you're interested in it. And they cover a whole bunch of different topics in the diabetes stigma field. But what I have a feeling some of you might be even more interested in is our Spoonful of Laughter campaign. So this is part of our culture hacking work. And essentially, we wanted to create a national social media campaign that used humor to actually educate about diabetes and push back against some of that stigma and stereotypes. So we partnered with comedians who are living with diabetes, and we made a bunch of videos with them that start to showcase what diabetes really looks like in a way that is hopefully very funny and entertaining, but also that has a lot more truth to it than some of the diabetes representation that you're probably seeing. One of the things that we always say is that we don't want to just like lecture people to change their stigmatizing behavior, but we actually want to like invite them along with us as we laugh our way through it. And we think that this will help lead us to a more empowering and respectful future. So you all are getting a little bit of a sneak peek because we launched this campaign at the end of last year, and we are going to be doing year 2 here in just a few weeks. So if you go follow us on Instagram at A Spoonful of Laughter or visit the website spoonfuloflaughter.org, you can catch all of our new videos that will be coming out here in just a few short weeks. This is some of the coolest work that I've gotten to be a part of. I'm so excited that we get to share this with people, and I hope that it's inspiring all of us to think about diabetes a little bit differently. And with that, I will pass it over to Audrey to talk about the Time and Range Coalition.
Thank you so much, Matthew. And as a person with diabetes, speaking to people with diabetes, dStigmatize and Spoonful is so incredible and such a great way to think about diabetes. So really encourage you all to look at it. So we're going to be talking a little bit about the Time and Range Coalition. Matthew, if you want to go to the next slide. So what is a coalition? We are over 30 industry partners, professional societies, and patient advocates, nonprofits who all really, really believe in the concept of time and range for daily diabetes management. Because if any of you on this call are not familiar, time and range, it shows you the entire picture of your glucose. Instead of getting an average every 3 months with your A1C, you're able to follow along and see where your management is going. And how it's been going for a day, 2 days, a week, 3 months even. And so it's really a wonderful guide to help you individualize your care to yourself. And so the coalition is ultimately aimed at, increasing the awareness and adoption of time and range, not just for people with diabetes, but for healthcare professionals, for regulatory agency. And we're not just doing this in the United States. We want to do this across the globe because we know and we feel so passionately about how much time utilizing CGM metrics like time and range can help. And biggest thing, time and range is for everybody with diabetes. So if you have type 1 diabetes and you're already using time and range, are you talking to your family members, your friends who have type 2 diabetes? Are you talking to people you know who are pregnant, who might have gestational diabetes? Time and range is for everybody with diabetes, and that's something we really, really want to underscore. You'll go to the next slide. So what are we doing? We focus on 3 different pillars of outreach and engagement. So we have healthcare professional education and outreach. That looks like a few different things. We have our timeandrange.org website, and it has a whole section for healthcare professionals. And really what we're trying to do there is just introduce the concept of time and range to healthcare professionals who don't already know, provide the resources so that they're able to support people with diabetes and really help them thrive. At the same time, we know that healthcare professionals only have 10 to 20 minutes with people in their care. And a lot of people with diabetes aren't even seeing an endocrinologist. They're seeing a PCP. So they're getting 5 minutes max spent on their diabetes and then 15 minutes on their neck ache and their cholesterol and things like that. And so, unfortunately, we know that a lot of education for people with diabetes, we have to do ourselves. And so, we also made sure that we are educating and we're engaging with our person with people with diabetes community as well. That looks like social media. It looks like our email list, which we'll talk about. It looks like, speaking to groups like you all. It looks like going to conferences and making sure not only people with diabetes are hearing about us, but it's also ensuring that we are in the room and that whenever decisions are being made, either with healthcare professionals or with regulatory agencies. Which leads me to our third, and that's our regulatory and policy engagement. So, what we really, really want, again, is an awareness and adoption of time and range. And how we get there, we're trying every single way possible because we want every single tier of the diabetes ecosystem to be aligned. And so, whenever we're talking to healthcare professionals and people with diabetes about time and range, and they're using those metrics and they're ready to go, but their health insurance won't cover it because because our regulatory agencies are a little bit behind and they're not sure that CGM use is right for everybody. Or whenever we're looking at different drug trials, if it's time and range included in those as a necessary endpoint. We want to make sure that our regulatory agencies and the policies that they are enacting align with what we're actually seeing in clinical practice, because ultimately that is going to help push forward better care for all people with diabetes. So we're also highlighting a lot of stories from people with diabetes, healthcare professionals. We have some really wonderful, amazing intro videos that you can all see. Visit timeandrange.org. For people with diabetes, we have a whole section on people who have never heard of time and range before, people who have heard of it but don't use it, and even people who are experts. So there are resources for everybody. We encourage you to go check out what we have. We have things from understanding your CGM metrics, like the AGP report, or even just time and range, to understanding the difference between DME and pharmacy benefits and if they're going to save you money. So, encourage you to check those out. Matthew, if you'll go to our next slide. Oh, this is just a little example of the site and what we have available.
Mhm.
You're good, Matthew. You can go forward. And we also have a free monthly time and range newsletter. So, depending on your person with diabetes or a healthcare professional or both, because there are so many wonderful ones, we send you a free monthly newsletter. The themes vary. So, sometimes we'll send you new resources. We just sent one that has kind of a time and range intro guide. We've created some really wonderful mental health toolkit graphics. We have a CGM guide, lots of different resources. Sometimes we'll just send you news. We just want to make sure that you're updated on all things diabetes technology, particularly around CGMs and time and range. So, like Matthew said, we will be able to, hopefully we'll be able to send this out. But if you visit timeandrange.org and go to sign up, you'll be able to sign up there as well. And another plug, this is all created by people with diabetes for people with diabetes. Our entire time and range team at diaTribe, we're all people with type 1 diabetes. We get it. And that is why we feel so passionately about this work. So you're hearing directly from us. We're the ones talking to you.
And then I think that is our presentation. So Scott, we'll hand it back to you and are excited to dive into some more in-depth conversations about this.
Well, yeah, thank you both. That was terrific. It's just really scratching the surface on all of the great things that is coming out of the diaTribe Foundation. So, one of my main goals with this webinar was to just expose the audience to the great things that you're doing, and then hoping that the three of us can kind of dig in a bit of a question and answer panel discussion format on a few more specifics. So, with that, Matthew, I'll start with you. You know, diaTribe's flagship program, Learn, it's been around for a long time, well over a decade now. Can you talk a little bit about how this program has evolved over time and why the organization believes so strongly in educating people with diabetes and their loved ones?
Yeah, definitely. And it holds a special place in my heart. I think I mentioned earlier that I've been at diaTribe now for a little over 5 years, and I've been in my role on the dStigmatize program for the last three. But when I first started at diaTribe, I was actually the managing editor of Learn. And so I got to be directly involved with some of our reporting there. And it is so cool to be a part of this work because I think the reason we believe in it so strongly is that so much of the information that is being shared about diabetes, so much of the science and all of that, it's not always necessarily geared towards the people who are actually living with diabetes. It's hard to understand. There's a lot of jargon. There's all of these qualifiers of, well, this is only approved because of this thing and for this thing because of this other thing. And it doesn't always make a lot of sense. And so diaTribe was founded to help people make sense of diabetes. It was what Kelly really wanted from the very beginning. It's why she started the newsletter and the website. And it's only helped us kind of be able to grow our audience and grow, the work that we do over time. In terms of how we've evolved, I think the biggest thing I would say is that we have leaned into professionalizing our writing staff a lot more. We've hired some amazing journalists who specialize in science writing. We've been able to ramp up our production. So back when I first started at Learn, we were going out weekly and we were trying to get a couple stories each week. But we got to the point of sharing 5 to 7 articles, in-depth articles every single week. And like I mentioned, this year we launched our daily. So we are trying to make sure that people are getting as much information as they want about the diabetes field delivered right to them. And I think all of this is hopefully in service to making people feel more confident. We want people to feel confident that they can talk about these things with their healthcare team and advocate for themselves there. We want people to feel confident in their diabetes, to know that this wasn't your fault and that there are ways to manage diabetes and live long, happy, and hopeful lives. And we want people to just feel confident that they know more about the condition they're living with, because diabetes is demanding and it is 24/7. And even so, just a little bit of help there, we hope will go a long way.
I would say it has gone a long way for me in my life with diabetes. It's one of the things I really appreciate about everything that comes out of diaTribe is you take often very complicated topics and make them feel very understandable, and I think that that takes a tremendous amount of skill and effort and work that happens behind the scenes to make it seem so seamless and easy on the front end. So yeah, as mentioned, I'm a fan, and I want more people to take part of what diaTribe has to offer. Um, Tell me a little bit more about the newest program, dStigmatize. Can you? I feel like many of us know what diabetes stigma is, but maybe haven't articulated it in that in those words. Can you talk about what is diabetes stigma and why diaTribe has devoted really an entire program towards raising awareness around the issue?
Yeah. So the kind of like definition of stigma is that it is going to be those kind of prejudices, the judgment, the shame and blame that accompanies diabetes. So in those moments where maybe you felt like, oh, if I had just taken better control of my diet earlier, I wouldn't have diabetes. Or maybe it's those moments where your healthcare professional says, your A1C is looking really bad. Why aren't you listening to me? Or maybe it's someone saying, should you really eat that? Don't you have diabetes? All of these little comments, they build up over time and they start to impact the way that you think about your own identity and your own condition, how you interact with the world. when you're anticipating that someone is going to make a really annoying or hurtful comment to you, you're going to change your behavior as a result. And what we are trying to avoid is whenever those behavior changes, those feelings that of distress or anxiety or frustration, when those start to have kind of these compounding impacts on people, they can actually affect the overall health. And we want to avoid that as much as possible. So we really believe that there needs to be more awareness around the fact that diabetes carries this social stigma. And if we can, we want to help validate people and let them know that these feelings are not, them being crazy. They're very well documented. We know that these are happening and that oftentimes that stigma is just misunderstandings or misdirection, and that there's other ways that we should be talking about diabetes. The reason we devoted a whole program to it is because we really believe that stigma is this kind of barrier that is blocking progress in a bunch of different ways. So, kind of an example where we can point this out is, if your healthcare professional has unconscious bias against people living with diabetes. Maybe they think that the people in their care aren't trying hard enough or that they didn't do enough to prevent diabetes. Those biases might then cause them to not share a new medication or a new technology because they think that somebody doesn't deserve it. Or maybe they don't care enough about diabetes to actually stay up to date on the latest FDA approvals or what is coming out. And then you end up with people who are living with diabetes going to this healthcare professional for care and not receiving good, respectful, empowering care that actually helps them. Creates this cycle. And we see it in a ton of different areas in how we think about diet or exercise recommendations and how people are portrayed in media and movies and films that are living with diabetes. And so we wanted to make sure that somebody out there, and thankfully there's lots of groups that have started to raise the alarms around stigma, but we really wanted to make sure that somebody was calling attention to this and was pointing out all of the different impacts stigma has. So that way we can address it and then start to move forward and progress and be able to address some of those challenges in these other areas.
Yeah, it's a frustrating but so important topic, and it just I think that there's so many great things that I have grown from in terms of being able to openly communicate about my life with diabetes, and it's just a shame that so many people don't feel safe doing so. So I really appreciate all the work that's happening there. Um, Audrey, can we shift a little bit and talk more about the Time and Range Coalition? It's been around for a few years now. Can you talk about how and why it was created? What successes have you found so far, and what's coming?
Yes, absolutely. Thank you. And I'm sorry if a little cat comes on screen. I'm dropping quickly, and I think my cat has really trained herself to be a diabetes alert cat because she gets all up in my face. Um,
Well,
but
if you need to eat something, you're in good company. No,
pretty
yeah.
good. I should be good. I'm not feeling it yet, but yeah, so the Time and Range Coalition has been around for a few years, 5 years, I want to say, which is really exciting. And how it came to fruition is Kelly and other leaders in our space, like I said earlier, they feel so passionately about CGM metrics and what they can provide. We actually have this really incredible database of research of over 300 or 400 um, studies and articles that show how incredible the use of time and range is for people with diabetes. We know that whenever people use a CGM and the metrics, it can help. And we're going to get into why I don't love this first point, but it can help lower A1C. It can help reduce the risk of diabetes related complications. It can help even increase your quality of sleep and your quality of life. So all of these wonderful minds from all different places in the diabetes ecosystem, they saw this gap of education and I don't want to say advocacy, but just a push for, who is leading the charge on time and range. A lot of things in this ecosystem happen slowly over time. And A1C is pounded into so many of our heads. There she goes. I'm sure you know, Scott, even whenever I go to the doctor and my time in range, isn't great and I get that A1C number, I'm still like, oh, I wish it was lower. I talk time in range every single day. And so, these people came together and I thought, who's leading the charge? Why can't it be us? And so the coalition is in this really amazing, unique space because we have over 30 members and they range from industry leaders. So we have incredible people with the finger of the on the pulse of innovation and what's coming next for diabetes technology. We also have members who are nonprofit. So we have ADA, ADCES, but we also have the American Council of the Blind. We have American Association of Nurse Practitioners. And we're really making sure that we have people, every sort of nonprofit who is touched by diabetes, has a say and is really involved. We also have patient advocates. Like I said before, our entire time and range team at diaTribe, we're all people with lived experience. So many people on the coalition they have lived experience. And then we also make sure that we're engaging others. And it's just a really amazing, unique space because we have all these people, even competitors, if you will, who are coming together for this common goal and really just feel so passionately about helping people with diabetes thrive, is what we all say. Because as long as whenever you know more, you can do more. And that's really what we like to say at the coalition is we want to help people know more so they can do more with their management, whatever that looks like for them. So some successes we've seen, we were able to commission some baseline research a few years ago. And we were able to see, yes, while a lot of endocrinologists know about time in range, over 50% of primary care physicians know nothing. And I hadn't even heard of it. A lot of them aren't using CGM metrics. And so we were able to say, all right, there's who we need to tackle. Because like I said before, there are so many people with diabetes who are not seeing endocrinologists. There is a major endocrinology shortage. I don't know the exact numbers, but I remember at ADA last year, they said like one endocrinologist for every like 400 to 500 people with diabetes. Obviously, every endo is not seeing 400 to 500 people. And so we wanted to make sure that, all right, let's see how we can work to close that gap. And so something that I think has been a really great success is we have connected with a lot of different HCP or healthcare professional, education programs. We work with Project Echo, which we're able to contact, rural practices with that. We're also able to speak to healthcare professionals in Canada at Blue Circle Health. We've spoken to your healthcare professionals, and in collaboration with Stigma, we're even able to talk to psychosocial doctors and psychiatrists. And so there's been this really amazing push to fill that gap. We recently did some comparative research to that baseline, and we found that the number of primary care physicians who do know about time and range has increased. And so we're seeing some movement there, which is not published data yet. So you're getting a little sneak peek there, but it's all very exciting. We also do a lot of work with the FDA and the EMA, which is kind of the European version of the FDA. And, a few years ago, I think some of us were told like, oh, they're never gonna, A1C is so solidified in our system. It's not even something to think about. And now we are continuously talking to the FDA and really pushing work forward there. Another success, which we are particularly excited about, and I think really highlights the power of the coalition, is we were able to publish an international consensus on CGM use in clinical trials. And what that means for people like me is that we were basically able to get doctors from all over the world, experts from all over the world, to agree on how CGMs should be used whenever they're doing clinical trials. And what that does is that sets the stage for there to be, solid use and consistent use so that a lot of the new research that's being done on new drugs and things like that, they include that time and range research. That has been cited over 100, possibly 200 times now, and it's only been published for about 2 years. So really, really exciting work there. Sorry if I went on. It's just been a really great few years.
So exciting. Congratulations on that. And it's the amount of work is sounds amazing, but there's still also a long way left to go, right? Can we I want to dig into the A1C topic a little bit more, but before we get to that, can you touch briefly on what what is available for someone living with diabetes on the Time and Range Coalition website?
Mhm.
Absolutely. So if you are a person with diabetes who does not have a CGM, you are just diagnosed, or you've been living with diabetes for a really long time, no matter who you are, we have resources to help you get started, literally step by step. So we start with what CGMs are available. And we, link out to some of our really amazing partners, Diabetes Y and ADWise and ADCES. They have great tools to see, all right, I know what CGMs are available. Which ones do my insurance cover? Because that's always going to be the number one question. We have literally a script that people can use to talk to their doctor about CGM metrics if their doctor is a kind of like, you don't need that, you don't need that. We have how to's on how to read, your CGM arrows, really everything you need to know in the beginning process. How to read your time and range, things like that. For people who already kind of know how to use CGM and they might see their time and range, and they kind of understand it, but they don't totally know more about it. We have a lot of information on, how time and range, utilizing time and range can really help you with long-term diabetes related complications. We have a lot of educational content about how you want to increase your time in range, which is really, really great. For people with diabetes who know time in range, you got it. Again, we have a lot of resources on how to dig even deeper into the material. So if you're interested in getting your AGP report, or you see your doctor looking at it and you're like, that looks cool, but super confusing. We have a guide to help you read that as well. We also have resources on how to get in touch with your time and range communities. So different podcasts to listen to, different blogs and pages to follow, which I think is really, really cool. Conferences to go to. And then again, like just really cool tips and tricks. Something I think that is really powerful that we worked on with Diabetes Action Canada is a lot of people with CGMs, and I'm sure you've felt it. Well, I don't speak for you, but I know I felt it, is that diabetes tech burnout is so real. We're thinking about numbers all the time, constantly. And so we created a little toolkit with tips and tricks on how to change your perspective whenever you're around diabetes tech to kind of help your mind become a little bit less irritated with it, but also tips and tricks on, taking a tech break if you really need it and changing your alarms, and just making sure that you're stopping the burnout before it happens, so that you can really feel empowered and engaged and take the break that you need.
I love that. And I also really appreciate how you've sort of categorized areas. So coming in, I know right where to go to find the resources that are probably most applicable to me based on my, level of comfort or familiarity with time and range. So thank you for doing that. All right, let's spend a little bit of time on that sticky subject of, this A1C, changing such a long-standing paradigm like A1C. That's a huge undertaking. Can you talk a little bit about some of the biggest challenges, maybe unexpected barriers you've encountered, and how is the Time and Range Coalition uh, working to overcome those?
Absolutely. Um, so whenever I introduce the concept of time and range to people without diabetes, I say, so you know what an A1C is, right? And they're like, yeah, yeah, yeah. And I'm like, okay, I want time and range. In 5 years, I want to ask you that about time and range. And I want you to say, yeah, 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 of course. Um, I think a challenge that we've seen is really overcoming the biases against diabetes technology. And I think Matthew can speak better to this, or not better, but can add some points to this later on. But in a few different ways. One, getting healthcare professionals, to understand that, yes, it might take a long time to get this integrated into your practice, but it is so worth it. I think for people with diabetes, they have been told A1C, 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 you're adding this new number. And they're like, oh my gosh, why are you trying to grade me on everything? And so we're really trying to, change their perspective and educate people about what time and range is. I like to say time and range is a guide, not a grade. A1C, I've said this before, it kind of feels like a scarlet letter. It's one number that defines you for 3 months, and it tells you if you're good and it tells you if you're bad. Whereas time and range is a really fluid number that doesn't define where you're going and doesn't define where you are. It's a guide to help you get to the goals that you want to achieve. So, say that I am, I'm trying I have a really bad issue with spaghetti, and spaghetti always makes me super, super, super high. What I can use time and range to do is I can test different ways of managing my glucose levels whenever I'm going to eat spaghetti, right? And so I can try it one day and do something with my insulin. And if my time and range the next day isn't great, I'm going to say, okay, maybe that wasn't the right way to do it. And then try something else. It can also really help alleviate some of that mental burden of a number being a definition. And so I kind of strayed a little bit there, but a challenge that we are facing is really trying to separate the number from that feeling of pressure and feeling like you're graded, because we've all been graded by our A1Cs for so long. It's really, really difficult to get out of that headspace. Matthew, did you have anything you could?
Yeah, Matt, talk a little bit about sort of that mental burden of adding another number to think about and keep track of. With diabetes, we're surrounded by all these numbers. So tell us a little bit about how a diatribe is thinking about that sort of mental and emotional burden of the diabetes data.
Yeah. I would say first is the message to healthcare professionals that we have to remove some of the value judgment language that accompanies all of these metrics. So, whether we're talking about A1C or time and range or cholesterol levels, these shouldn't be viewed as good or bad, but we need to try to find more neutral ways of talking about them, which sometimes is just the number. 70% time and range can be the number that you share with somebody in your practice instead of saying, oh, this is a really good time and range, great job. Even whenever we are using those positive terms, it kind of implies that there is some negative thing that you should avoid. And so if we can move away from some of that value judgment language, it definitely helps. And that's definitely a note to our healthcare professionals. For individuals, there's kind of two things I want to mention. One is what Audree said, which is it is always okay to lean on your support network or to take a break from diabetes tech or diabetes data if you need to. Maybe it means asking a friend, a partner, or a family member to help you track some of that data as it's coming in, using a follow app or something, for example, to help you manage your diabetes and take some of that burden off of you, the sole individual. Or maybe it means taking a week-long break and going back to finger sticks and insulin injections, because that might just be what works for you in that moment and helps you kind of unplug from diabetes all the time. The last thing I'll mention is that one of the kind of key differences that we try to make sometimes between A1C and time and range is think about A1C as kind of like your final semester grade. It tries to average everything out and it gives you this one big number that is you either passed or you didn't pass the class. And it can feel like such a heavy weight. When we think about time and range, we want to think of it as kind of like all of those little assignments that you worked on throughout the year. Maybe you did good on some, maybe some weren't quite what you wanted, but hopefully you were learning through that whole process. And each one of them is only a small little fraction of your overall experience living with diabetes. So yeah, sometimes, seeing that you got a time and range of 20% feels really bad, and that's okay. but hopefully that informs some of that learning and helps you make adjustments in the future in a way that you are kind of constantly looking at ways to, hone those things that you're doing well, maybe improve a little bit on the things that aren't quite where you want them. And overall, just let those numbers carry a little bit less weight. That's our hope.
I love that approach. And it's, again, it gets back to these numbers are tools for us to use to get a little bit smarter about adjustments that we may need to make. I also appreciate about time and range that I can sort of slice that down to much smaller pockets of time than with an A1C. So yeah, it's a very useful tool. So let's shift a little bit and talk about some of the practical day-to-day application of time and range. So Audrey, when you're thinking about a healthcare professional who's still really focused on A1C, what's one piece of advice you would give them to start integrating time and range into their practice in a meaningful way?
I think look at the lows. So a great story, not great story, it's a very sad story. But we I know somebody and she is a mom and she got her blood work done and her endo calls her and says your A1C is 6.5. Do not change a thing. You are doing incredibly. Um During that call, she was literally on the floor with her third low under 50 of the week with her 9-year-old daughter giving her juice. And she was like, "That's great. I'm so low. I keep getting low. I have to change something because I don't like that's great that my A1C is great, but my time and range is not great. My time and range is, my time below range is much higher than it should be." And they changed, like her carb to insulin ratio by like 0.5 or something, and it totally fixed the issue. And so this is a direct quote from a geriatric endocrinologist who actually uses time and range. Time and range shows you the full picture of someone's glucose. It shows you the full story. So you're able to target different issues, or it's like target different areas where somebody's struggling. So you're able to look at the graph and it is so beautifully color coded. It's so easy to see. You can see red, time below range, yellow, time above range. If your red is a little bit more than it needs to be, all right, you know where to start. You can say, oh, you're having issues with hypoglycemia. That's dangerous. Let's start there. Oh, hey, or wow, you are, 70% yellow. Let's see if we can get that to 60% yellow. So time and range gives you a starting place without having to guesstimate. I would love to know how many healthcare professionals actually get those logs from the people in their care, writing down every single sugar because I'm not doing it and I never was doing it. um, so it allows you to take away the guesswork and get to the root of the pain point that somebody's feeling and like ultimately help the person in your care feel better faster and achieve their goals too.
Yeah, that's great. Thank you. Um, I'm going to move a little bit faster through some of the questions here, just keeping an eye on time. But there are some important ones that I really want to focus in on a bit. So, for the person with diabetes, uh, how can someone, regardless of their technology use, get started with understanding and using time and range data?
Absolutely. So again, the website can be really, really, really helpful. If you're a healthcare professional, we always say you are a team with your doctor. You guys figure it out together. They should have the resources for you. We have resources on timeandrange.org, but also a really wonderful place to start that is not as overwhelming as doing it yourself is finding that community, talking to a me or a Scott or finding somebody who has used diabetes technology before, and really just having a one-on-one conversation because community, peer-to-peer, that is always going to be for me. And I think for a lot of other people with type 1 diabetes, especially, that's going to be the most helpful.
And I was going to say, just to add one little thing too, a fun thing that my dad lives with type 2 diabetes. And when he was using his CGMs for the first time, it's very easy to sometimes focus on what feels like is going wrong, like, oh, my time range wasn't quite what I wanted. What am I doing wrong? It's equally as effective sometimes to look at what you're doing right. And so, especially if you're someone who maybe is experiencing some more of that diabetes burden, maybe some of that mental health struggle, maybe you're dealing with burnout or distress. Sometimes switching the kind of way that you're thinking about your data and trying to find, hey, I was perfectly in range all night last night. What did I eat before bed? Did I exercise? What did I do differently? And then trying to, replicate some of those successes can be a much nicer or kinder way of easing into time and range as well.
A
Yeah,
quick
I love that.
There are 42 factors that we know of right now that affect your glucose levels. Every person with diabetes should be aware of those. And that's kind of a big stepping stone in understanding diabetes tech and glucose levels as well.
Yeah. Matthew, you mentioned kind of shifting perspective a bit. That's another thing I really appreciate about the time and range metric is, for example, if I have time above range, it's a pretty good bet that my time below range is in target, right? Like and so it sort of gives you always want to have something good to think about or talk about. It can really just set you in a right mindset. While you then focus in on some of the areas that you need a little bit more help with.
Yeah.
Um, but do we want to think about time and range all by itself, or is it one of a handful of numbers that can together help us live healthier lives with diabetes? So we've got the A1C, we've got time and range, we've got um, glycemic variability. It can be a lot to process, but these are also all different tools that can help us really zone in on what conversations would be most beneficial when we've got time with the healthcare professionals that can help us with those, right? Can you talk a little bit about that?
Oh my gosh, dangerous question for me. I'm going to nerd out about my AGP report, my favorite thing, which this might be a lot to absorb, but there is a guide on timeandrange.org, on the healthcare professional toolkit, actually, all about the AGP report. But we do say there are really three metrics that you want to pull from the AGP report. And for those of you who don't know, you can get your AGP report through your CGM app or tool. So for Dexcom, it's on Clarity. For Libre, I think you have to go onto your desktop and find it. Medtronic, same thing. But it is basically a one-page report that tells you the whole story of your glucose. And so there's GMI, which you might see, and GMI is similar but not equal to an A1C. And that some people use it to estimate their A1C. We don't always love, phrasing it that way because they are going off of different numbers. Your A1C, not to get too scientific, but it basically measures how much sugar is on your red blood cells. Your red blood cells kind of die off and regenerate every 3 months. And so it's not always accurate. It's always also not accurate for many people of color, people with chronic kidney disease, or pregnant women, or people who are pregnant. And so what the GMI does is it's an average of this interstitial fluid, which is how you test your glucose through a CGM. So it's a little bit different, but if you are looking to kind of prepare yourself for what you might see for an A1C, that's going to be your GMI. There is also the coefficient of variation, which is going to be your variability. You want that to be under 36%. And what that is how wide you're swinging. So there's a really beautiful graph that I can't pull up right now, of 7% A1Cs. And the first person, they have a 7% A1C and they are perfectly in range. They are a straight line. Wouldn't we all love to be there? The second person is absolutely riding the roller coaster and they're going like this. But because they're so high and they're so low, they have a perfect A1C because it averages out. Those highs and those lows, that's what the variability metric measures. And so you want that to be under 36%, which don't do the math yourself. Your little app will tell you. Um, and then you have your third graph, which is a perfect 7% A1C. And it's just kind of a smooth, about 70% in range, what we want to see. So that variation is very, very helpful because, as a lot of people with type 1 know, the more we go up and we go down, that's really hard on our organs. We already have issues with our organs, so you do want to protect those as much as possible. And you want to stay in range as much as possible. My favorite is the AGP graph. And this is really hard to explain without like a little, feel like I need a whiteboard behind me. But your AGP graph is able to show you patterns. So it'll show you what time of the day you're averaging a little bit higher. And so that is really what can help you take action in really those small actions. So you can say, all right, I'm kind of averaging around 250 about 2 hours after dinner. That means maybe I need to do an extended bolus. Maybe I need to change what I'm eating. Maybe I need to talk to my healthcare professional about my dosing for the nighttime. And so those are all very cool metrics that if you really want to nerd out, and you can get very, very detailed with it. But it really, really helps understand your glucose in a different way. And working together with time and range, it's just a perfect picture.
Yeah, that's great. I'll track down an example AGP report and include that along with all the slides and everything in the follow-up email. Let's shift a little bit and start thinking about the future, the years ahead. So if you were to think 5 or 10 years ahead, what do you see as the North Star for the Time and Range Coalition? What does a world look like where time and range is now it's a fundamental part of diabetes care, as you alluded to earlier, right? Where you mentioned the A1C and they knew it.
Exactly. I think, like I said before, that, if you are watching a commercial on TV and you see, oh, hey, it lowers A1C, we'd love to hear it lowers or it increases time and range. Um, we want people to be able to access and be aware of the entirety of their glucose story. And so really just having this widespread awareness globally, to have us all on the same page and to have us have all of the data necessary to know, how to help people with diabetes live the happiest, healthiest lives possible. We say happy and healthy because, those two things aren't always completely synonymous. And so we want to make sure that we're achieving a balance, but we want to make sure that, if you say, oh, A1C, people are like, it's so important. But, you can say time and range in a conversation with anybody and they're going to know what you're talking about. That's the dream for us, for sure.
Yeah, wonderful. All right. Well, just keeping an eye on time, I want to ask you each sort of a concluding question, right? So if you could leave our audience with one final message or call to action, what would that be? And Audrey, I'll start with you, and then Matthew, come to you.
Um, Remember that everybody's diabetes is different, and make sure that you are advocating for yourself and for others. Um, and just to use time and range as a guide, not a grade.
Yep.
Time and range is your guide for your diabetes. And if you know somebody else with diabetes, spread the gospel. We'd love to hear it.
I love that. Thank you, Audrey. Matthew, how about you?
Yeah, I would just say that I hope that we all continue to make space in the diabetes field for conversations around the emotional, the mental, those social factors that influence life with diabetes. I think for a very long time, we have all been like hyper focused on the biomedical. What do our glucose levels look like? What is the medicine that fixes it? What is the technology that can solve our problems? And all of that is extremely important, but it is not the entire picture when it comes to diabetes life or diabetes care. And then we can start to think a little bit more about the psychological impact, that mental burden that diabetes carries, and find ways to support people through those challenges, it'll improve diabetes care across the board. And so it's one of the things that we really care about at diaTribe, but we just really hope that we are helping to make space for these types of conversations for more people.
Yeah, well, job well done so far. diaTribe has made my life with diabetes a much better place. So thank you both very much, and let the great work continue. Um, if you'll bear with me and hang out for a second while I kind of wrap things up, and then I'll move into a closing piece about Blue Circle Health. So everyone that's watching, again, thank you. We just really appreciate you attending and sharing your time with us today. I know it was a lot of information, but don't worry, I'll send out the recording and the slides and example AGP report and anything else I can find that we covered in the conversation today. So thank you, Matthew and Audrey, for taking us through all that information. Everyone at diaTribe, again, makes even the most complicated topics feel easy to understand. So thank you. I'd like to ask you all to stay tuned for future events like this. Last week, we had a great webinar where Samantha from Touched by Type 1 shared a ton of information about navigating popular employer and commercial insurance options. So I highly recommend you go back and take a look at it. If you'll be dealing with open enrollment soon, you can find that replay on our website, in the events page, and on our YouTube channel as well. And then coming up, we've got the monthly group sessions in both English and Spanish. The English sessions will happen on Thursday and Friday, October 2nd and 3rd, with the Spanish session following the following week on October 9th. So keep an eye out for those details. And just a friendly reminder that those group sessions are open only to past and current Blue Circle Health program participants. And then I'm currently working to coordinate an exciting webinar with several other community partners to talk about the importance of participating in clinical trials. And we don't quite have a date locked in for that one yet, but I'm working on it and we'll have more details soon. So check out our events webpage for more information and to register. And that's at bluecirclehealth.org/events. And then finally, please do share your feedback. Depending on how you joined, you may see a survey once you close out of here or in the follow-up email. We would love to know if this was helpful and what other topics you'd like to cover. So moving on to the Blue Circle Health Explainer, we'll let Matthew and Audrey drop off. Thank you both again for being here. We really appreciate it.
Thank you for having us, Scott.
All right. So for anyone here who may not be familiar with Blue Circle Health, I'll share a quick 5-minute overview, and then I'll stick around to answer questions. And we'll let Matthew and Audrey drop off. And for those who already are familiar with us, you can also drop off anytime that you like. So let me get our slides back. Here we go. So I'll just walk through a quick overview of what Blue Circle Health is all about. And if you have questions along the way, go ahead and add them to the chat, and I'll go through them at the end. And then this should only take a few minutes. So people with diabetes shouldn't have to fight for what they need to live. Blue Circle Health created a free clinical care, education, and support program so that you can focus on living, not just surviving. We're a nonprofit organization with a 6-month virtual program that's made possible thanks to generous funding by the Helmsley Charitable Trust. Everything that BCH, Blue Circle Health, offers intends to close the gap between what you actually get from the existing healthcare system when you have type 1 diabetes versus what you really need to thrive. So what exactly does that mean? Well, we offer a free, flexible program to extend care between your normal healthcare visits. Our program is up to 6 months long. It's individualized to meet your specific needs. It's done entirely virtually over Zoom, text, and phone. It offers as much or as little support as requested. So that means you can take advantage of every service we offer or just pick the ones that you need. And I'll get into more details on that in just a second. You stay connected to your medical homes, and we send regular updates to them throughout your time in the program. Our services are free, regardless of insurance or immigration status. Re enrollment is possible 1 year from the original enrollment date. The graphic on the right shows the available services, and I'll describe them in more detail, going counterclockwise and starting with clinical care. Clinical care is exactly what it sounds like. It's visits with an endocrinologist or an advanced nurse practitioner. Insurance navigation is consultations with insurance specialists who can help you understand and maximize any insurance coverage you may have. They can help you find insurance coverage if needed and also help with prior authorizations. Diabetes supportive counseling offers help with the emotional burden of type 1 diabetes. Case management, our case managers can help if you're struggling with maybe food, housing, or employment insecurities. We know that you're not going to be able to focus on your diabetes necessarily if you've got some of those bigger things you're concerned about. Peer support and community. In addition to monthly group sessions, as I mentioned, you'll have a dedicated T1D support guide to work with who will help you sort of navigate all the other services. They can answer any questions you have, and they're just generally there for you if you just need someone to talk with about your diabetes. We also have ongoing community events like this and connections and introductions to other great organizations doing work in the type 1 diabetes space. Education and nutrition, these are visits with registered dietitians and certified diabetes care and education specialists. And then there are 2 additional programs available within the Blue Circle Health program. The first is prescription assistance for qualified applicants who maybe need help paying for supplies and medications. The qualification for that is an income level at or below 300% of the federal poverty level. And then Intro to CGM program provides 3 months of free education and access to a CGM for those who have not had reliable access to one before. We're now available in 11 states, with 4 more coming very soon. And we've helped over 875 participants since January of 2024. So you might be asking, how do I take advantage of this? Well, it's really easy to get involved, and that's our main goal, is to make it easy. The eligibility requirements are as follows. Diagnosis of type 1 diabetes. And no, this is not just for newly diagnosed. We're here for you anywhere along your T1D journey. And yes, this does include LADA. You must be 18 years old or older, speak English and or Spanish. So all of our programming is available in both English and Spanish. You must be able to connect and participate in virtual care. So that means usually access to a smartphone or computer for Zoom video calls. You must have a primary care doctor or endocrinologist, or be willing for us to help you connect to one. Then you must live in a state where we're licensed to help in, and then no current pregnancy. And again, that list of states, I know I flashed it very quick up on the screen, but the list of states is growing really fast. So again, I mentioned we're in 11 states today. We've got 4 more coming very, very soon. So the best thing to do is head to our website for the list of the most current states that we're available in. And when it comes to getting started, it's really easy. It's just 3 easy steps. You can sign up yourself on our website at bluecirclehealth.org. We'll contact you to create a care plan that meets your needs. Once you fill out your information on our website, someone will reach out to you within just a day or 2, and then you'll start your T1D care and support program. So I'd like to share a short video from a few of the people who have gone through the program. It's about 3 minutes long, but while that's playing, if you have any questions, go ahead and share those in the chat, and I'm happy to stick around and answer them after the video's done. Thanks.
When I explain it to people, I usually say,
Living with type 1 diabetes is pretty burdensome,
complicated, it's really, really tough.
challenging, too many ups and downs.
I'm never not thinking about it.
I lose a lot of sleep, it's very emotional.
The only predictable thing about type 1 diabetes is that it's unpredictable.
It makes me feel really vulnerable and afraid. And I don't like feeling afraid and vulnerable with my diabetes.
My daughter was diagnosed when she was 3. You know, if I couldn't afford for both of us to get supplies, and I'll just literally take the shirt off my back, take the insulin out of my body and put it to her.
Like, it's about every day. And insurance shouldn't be such a fight.
I literally spent days on the phone calling the provider, calling the pharmacist, calling the insurance, calling the pre-op company, and then calling all those people again to tell each other what the other one said.
It's like everyone's pointing their fingers at someone else. In the meantime, I'm watching my supplies dwindle away to nothing.
Like, that's a constant fear, you know?
And so things that feel like a fundamental right are out of reach for many people.
It's just wrong.
A friend of mine on Instagram sent me Blue Circle Health, so I immediately signed up. Blue Circle Health is a nonprofit with a free clinical care, education, and support program. We deliver our program entirely virtually. It's all telehealth, and it's up to 6 months long.
You get education, you get support, you get assistance navigating insurance. It's phenomenal.
I don't know where I would be right now if I didn't find Blue Circle Health. They picked me up when I was at one of my lowest points.
It's just honestly a godsend.
Felt like they get it. It felt like we're making the change that we should already have. We were really fortunate to have funding from the Helmsley Charitable Trust to make this possible and create this program and be able to offer it for free. My life has like drastically improved. I have really great insurance. The insurance counselor through Blue Circle was amazing. Not much makes me like that emotional, but like having to not worry about the financial aspect of that as a single mom who's like rebuilding is, yeah, it's really like comforting.
Yeah, I'm crying.
And if Blue Circle Health can get out there and show people that this is the right way, it's the right thing to do. You don't have to go through it alone.
All right. Thank you very much for your time and attention and patience with that. I don't see any questions that have come in. So just another reminder to visit our website at bluecirclehealth.org to learn more and sign up. And you can check our events page there for the latest details on upcoming events just like this. Thanks again for being here.